All right, Jamie. So as we move here into preparation work, let's first start by having you show me your releasing breath that you have learned in other therapy. I know it came up for us during our history taking session as being something that's helpful. So I'm wondering if we can start by you kind of teaching it to me.
Sure.
And then we'll do it together.
Well, and the way I teach it to clients, hand on the abdomen, hand on the chest.
Okay.
Going to inhale through the nose, hold in the diaphragm for a count of 4.
Okay.
Exhale by just dropping or just allowing our jaw to just drop open naturally and making a sound in the back of our throat to allow us to exhale a little bit longer than the inhalation.
Nice. Nice. So go ahead and show it, and I'll drop in and do it along with you as I can. And how many do you usually like to do? Or does
Anywhere from 1 to 3 usually.
Okay. You willing to do 2 more?
Sure.
Right now? Great.
And if we get more movement in the diaphragm, it's my understanding that it's more effective and less if we're breathing more from our upper chest area.
And I noticed you were giving yourself a 4 count there.
4 count.
Does that seem to help you nicely for the hold?
Sometimes.
Okay. Sometimes less, sometimes more?
Right. As far as around 4 seconds. And sometimes it's helpful for me to do that to help remind me.
Got it. All right.
But I don't always.
All right. Let's do 1 more. So what are you noticing in your body right now?
I can feel the relaxation, that sort of, for me, a tingly feeling that just washes over me.
Very nice. I'm going to go ahead and strengthen that with the machines. I know in a previous conversation we talked about your willingness to do audio. So what you just described, that kind of relaxation washing through you, I'm going to invite you to notice that. Sink into that. If it feels organic, to try another breath or 2 with that. Just notice what you notice as you hear the slow tones back and forth. Another breath. What are you noticing now, Jamie?
I feel much more relaxed.
Okay. All right. So I know you've had work with previous therapy, specifically some previous EMDR before. So knowing yourself, how would using the breath like this help us as we go into targeting the traumatic memory you want to work on?
If I get pretty activated, pretty upset, when it's time to calm down, or if I need to calm down, I can use the breath as one of the tools.
Sure, sure. And would you be comfortable with having me use it like as a Jamie reminding you to breathe? If it feels like maybe you need just a little grounding break in the middle of the work, even if you are still activated?
That'd be great.
Yeah, 'cause it seems like it's a really good strategy for you. So thank you for showing that
You're
to
welcome.
me. And great. So we have a couple other tools here at our disposal. Yeah, you can take the headphones off for now, but keep them handy. So you mentioned that for grounding you prefer soft texture over hard texture. So we go ahead and bring the stuffed animal in.
choice.
Yeah, you got your choice. So actually have you put the headphones back on. We're going to tone a couple of these things in just as resources. Okay. So I'd really like you to be mindful of the texture. And just sink into that as I begin the stimulation. What are you noticing?
Box is soft.
Yeah. Just notice soft. Anything else you're noticing?
I'm feeling pretty calm.
Cool. So we'll have the Fox on hand as soft texture if you need for grounding, for anchoring, or if we need to close our session early. I'm also fine if when we're doing the trauma processing, if you even want to be holding on to the Fox. That would be more than okay with me. So you could either keep them with you or put them to the side. So just as a point of reminding you, we also have 2 of your favorite oils nearby, lemon and peppermint, which we can access. And then, as you mentioned to me, some art materials can also be helpful. We have some pastels, colored pencils, markers, crayons, and paper. And I think it's interesting in our previous conversation, you mentioned that, correct me if I'm wrong, that some of your different parts like the different implements. Okay. So that goes into our next area we're going to talk about, which is the role of some of these little ones, the role of some of these parts that you've been able to unearth in previous work. So just give me a little bit of backstory on what you think I need to know about them, specifically what it may be like inviting them into your magical safe place here.
Some are more cooperative than others.
Okay.
Knowing what I know now, they were a tool at the time. Certain entity, I don't know what terminology necessarily used, but
whatever works for you.
Certain ones serve certain functions. Depending what was going on. And at times it was something along the line of when that little one became too full, again, for lack of specific enough vocabulary or difficulty putting things into words, that some other little one came along to help. It's a joint, at times more of a joint effort to survive.
Yeah. So as we discussed when we did our screening, I'd like to try doing your magical safe place and really inviting in all of your parts. And we'll see what happens in terms of who is maybe saying or communicating what in terms of being on board, in terms of cooperation, and we'll see where we go with it. Okay, so do you want to still hang on to the Fox? Yeah, great. Okay, sounds good. I'm going to have you keep the headphones on, just because at various times I'll be inserting the stimulation. A lot of times it'll just be us kind of talking and sensing in. So does it help you to close your eyes or to leave them open?
It depends.
It depends. Okay. So we'll, you know I like that phrase. So let's roll with that as we go. So describe for me some of the qualities, Jamie, of your magical safe place.
Qualities?
Like, what is it like? Describe it for me.
Oh, okay, just describe it?
Describe it.
Okay. My guardian angels are completely around the safe place, and so it is safe because they're protecting me.
Okay.
I'm up on a hill it's not really a forest because there's not enough trees to make a forest, but there's quite a grove, maybe would be a better term. Long needle pines, and it's very comforting to hear the wind blow through those. To me, there's a difference between the wind coming through pine trees, especially long needle pines, versus deciduous trees. And there's a brook that goes through there. I can hear the water. I can feel the sun. Very comfortable temperature. I can feel the grass and the ground below me. And I'm shielded by shrubs. I'm up where I can see around me, but nobody can see me.
Okay. Can you let yourself go there? Okay. Take a couple breaths, just natural breaths. Let your place that you just so beautifully described for me come into focus. Noticing those beautiful details.
And the smells of the pines.
Yeah, notice those. So I'm going to start a set of tones to strengthen, noticing the pines and the water. What are you noticing now, Jamie?
Natural safe place is more real,
Okay.
more accessible.
Okay. Are you okay to notice that? Real? Accessible? Okay, keep going with that. And what are you getting or noticing now?
Natural safe place is real, it's accessible, easily accessible.
Is there a name you use for it other than magical safe place, or does that work really well as a cue? So let's just do one set to strengthen that, magical safe place, so that you can say the phrase, I can say the phrase whenever we may need it. are you noticing now?
I get relaxed.
Great. Okay, Jamie, so now I'm going to invite you, if it feels organic, to check in with those little ones, with those parts. So the direct invitation I'm going to make is, can you invite those little ones into this magical safe place with you? Okay. So take a breath. We're not going to do the machine just yet. Maybe take a breath, invite them in, and notice what you're noticing about any of them here in this magical safe place with you.
They're in different places doing different things. Some are sitting, some are standing a ways away, some are kind of playing around.
Okay. Are you willing to notice that? Okay, I'm going to do a set. Just notice some are sitting, some are standing, some are playing. Not judging or censoring. Simply being present to what you're noticing. What are you noticing now?
They're there.
They're there. Anything specifically coming up?
Everybody feels relaxed.
Let's strengthen that. Everybody feels relaxed. What are you noticing, or what's happening now?
Just hanging out.
Okay, just hanging out. So this calm, peaceful, or not calm, magical safe place feels like it's a good anchor to come back to if we should need during the reprocessing, or if the session has to wrap up early. And I'm also hearing that it sounds like a good place for all of the different parts that may be at play, which is why I really like this as a resource. So the last little component I want to cover in terms of resourcing and preparation is, you've mentioned to me that in previous therapy and previous work, some of the parts have not been so cooperative or not been so on board. Can you give me any more insight into that, or what you've observed in previous therapy?
What's coming up is that the counselor was okay, but they didn't get it.
Okay.
And that's the feeling I'm getting, is that's where the resistance came in.
Okay.
It's like, we're not going to help out because it's not worth it almost, or we're not going to get anything out of it.
So is there anything we can bring in to assist those little ones who have felt that in the past? Is there anything they need to ask me?
Okay. Because what was coming up first was just that they were all aware that you get it more than previous counselors who, for the most part, only did the talk therapy. But especially two of them felt safe enough that we would share some things. Does that make sense?
Yeah. Are you willing to just notice that experience of feeling safe enough? Because one of my beliefs as a therapist, and I'm communicating this to all of your parts, is I never expect anybody to feel 100% safe in a therapy venue, because this is risky work, and a lot of us have come from daunting places. But I think it's important to be able to sense into what it means to feel safe enough, or to believe one is safe enough.
Safe enough to do some work,
Mm-hmm.
safe enough for the time being, knowing that it can change.
Yeah, so even as we're talking about it now, Jamie, what's happening in your body? What are you noticing in your body?
There's a brightening.
Okay, let's strengthen that brightening. What are you noticing?
We don't feel like we have to take care of you.
Okay.
Some parts of the times, there was more concern that we didn't want to scare the counselor, for lack of maybe better terminology. And other times, what would they think of us? They didn't understand.
So what I'm hearing is they're experiencing more a sense of not having to protect me, and some assurance that I understand at least a little better. Okay, and again, what does the body notice?
More relaxed.
Okay, so this will be kind of our final preparation set. Let's take a couple breaths into that, noticing that sensation of more relaxed. So anything you feel we need to do to transition from this exercise? Do you want to make contact with the texture? Do you need to look around the room? Do you need to do your release breaths?
You're doing well, thank you.